Smog on the streets, everyone in masks, eyes burning before the day even starts. The internet has questions, and we are taking them straight to the experts. Kicking off this episode, Dr. Ankit Bansal answers what people are asking about air pollution.
I am Dr. Ankit Bansal. I am Senior Consultant Pulmonology and Critical Care at Fortis Jaipur, and I am also the chairperson of the Jaipur Forum for Clean Air. Once we exposed to air pollution, then possibly there are different things that went into our lungs, which could be your gases, like soft nitrogen dioxide, ozone, sulfur dioxide, fine particles like PM 2.5 or PM 10, and various toxins that we inhale. So what these do, they irritate your airways, that means your lungs. Beside this, it slows down your cilia, it produces more mucus, and you experience the symptoms of asthma or COPD of the likes of cough, chest tightness, dyspnea or discomfort in breathing or wheezing. So there could be different reasons related to it. Maybe some people are already predisposed to certain diseases, which may be like they are already asthmatic or they are having already a COPD patient. Some patients are already heart patients, so they are already vulnerable to more of the air pollution. Some patients are more vulnerable to the external surroundings. Their genetic makeup is like that. So whenever they get exposed to these air which contain polluted material, they have more symptom as compared to the other patients who don't have these underlying causes within it. So any discomfort air will discomfort you. You may have irritation in your eyes, you may have irritation in your throat, and possibly you feel some suffocation which is going on in the environment in which you are. So this can easily reflect you that possibly you are in some uncomfortable environment. So your clinical well-being of your body decides that maybe you are in an uncomfortable surrounding. Yes, it may be, because these individuals who are having any kind of allergies, sinus problems, asthma, they are predisposed to any kind of trigger. So if the trigger is strong, then the symptoms of these diseases could be provoked. And any content of the air pollution are strong enough to provoke the symptoms of asthma or COPD. Yes, there are always certain tests to assess for your lung health. The most simple of them is your pulmonary function test, which is known as, in simple terms, PFT. Another is DLCO, that is the diffusion capacity of the lungs. So these are very simple tests which can be, as advised by your clinician or doctor, you can always go ahead with these tests and assess your lung functions. Sometimes you don't have symptoms, but these tests shows your abnormalities. Yes, they are really very fine, the 2 particles 2.5, and they can settle on these food products also. And we know that when we consume these food products, we are actually, along with that, we can take the particles along with that. So they can have the harmful effect which we can get while we inhale it. One thing I would like to make it very clear that air pollution problem is not an individual problem that we need to address. The stakeholders are everyone, and you as an individual as a whole. So it is a combined entity that needs to be addressed. We have to devise measures by which we can reduce air pollutions, and as an individual, what we can do that is that we can do every best efforts to protect ourselves from the harmful effects of air pollution.
Got more smog myths or pollution questions? Ask them below and follow for clean air answers.
Like and subscribe to Planet Pluc for more wildlife stories and nature updates.